Hey there, welcome back to the channel. Have you ever been brushing your teeth? You spit out the toothpaste and you see a little bit of pink in the sink, just a few streaks of blood, or maybe you took a sip of your morning iced coffee or a hot tea and out of nowhere, zing, a sudden sharp. Please don't do that. Again, kind of feeling in your tooth. And here's another one. Have you ever been talking to someone and you catch yourself wanting to cover your mouth just a little bit because you're worried about your breath? But here's the one that really gets people's attention. You're looking in the mirror one day and you notice something different. Your teeth look longer, the gaps look bigger. And when you gently touch one with your finger, does it feel just the tiniest bit loose? Okay, take a deep breath. Let's not panic, but also let's not do what so many of my patients do, which is wave their hand and say, hey, I'm just getting older. This is normal. I'm here to tell you. As your family doctor who has seen this in hundreds of patients, that is not normal aging. What you are describing are the classic textbook emergency signals of gum disease. We call it periodontal disease. Think of gum disease like a quiet termite infestation in your mouth. A cavity, that's like a fire alarm. It hurts, it screams at you, you run to the dentist. But gum disease, it's silent, it's sneaky. It doesn't hurt much in the beginning. It just quietly, slowly eats away at the foundation of your teeth, your gums, and the jawbone underneath. It starts small, maybe just red, puffy gums that bleed when you brush. You think, oh, I just brushed too hard. But if you leave it alone, the gums will slowly start to shrink, the bone will start to dissolve, and your teeth, which should be like strong trees in deep soil, become like trees in a pot of sand. A little wind or a wrong bite into a piece of toast, and they can loosen, shift, or even fall out. But here's the part that keeps me up at night as a doctor. Gum disease doesn't just ruin your smile, it could cost you thousands of dollars in copays and out-of-pocket treatments over the next 10, 20, 30 years. One of my patients just paid almost $4,000 for deep cleaning and gum surgery. And it's not just money, it's linked to real serious whole body problems. Harder to control blood sugar, higher risk of heart attacks, even trouble with blood pressure, and it quietly steals the small joys, enjoying a Thanksgiving dinner without pain, laughing with friends without covering your mouth, eating an apple without seeing blood. Now, I know what you're thinking. I hear this in my office every single week. Doctor, my gums have already receded. Is it too late? Is there any hope? I brush my teeth every single day, twice a day, so how did I even get this? And if my gums are already shrinking, can they actually grow back? I promise you, we are going to answer every single one of those questions today. I'm going to tell you the honest truth about what can be fixed and what can't. I'm going to show you how in just 3 days you can start to turn around the bad breath and the redness. And more importantly, I'm going to give you a simple, doable, lifelong system to protect your teeth, whether you're 25 years old working your first job or 75 years old and retired. You can avoid this trap. Let's start with the basics because I think a lot of people are confused. What is gum disease? Really, so many people mix this up with cavities, but they are completely different problems. A cavity is a problem with the tooth itself. Imagine an apple. A cavity is like a wormhole right in the middle of the apple. The apple is rotting from the inside. Gum disease is not that. Gum disease is a problem with the ground around the apple tree. It's the soil, it's the foundation. Your teeth stay firmly in your mouth because of 2 layers of protection. First, your gums, that's like a tight, cozy jacket wrapped around the root of each tooth. Second, your jawbone, that's the soil that the roots are planted in. Gum disease is when bacteria first break through that jacket. Your gums, they cause inflammation, bleeding, and redness. And if you don't stop them there, they start eating their way deeper into the soil. Your jawbone, as that bone dissolves, your tooth loses its anchor, and that's when you feel looseness. So what about gum recession, that shrinking, those teeth that look longer? That is one of the clearest, most classic signs that the disease has been working for a while. When your gums shrink back, the root of your tooth gets exposed. That root is not protected like the top of your tooth. That's why you feel that zing with cold or hot things. That's why the gaps get bigger. So the big money question, can receding gums actually grow back? Here is the honest, evidence-based, I've seen it in my office answer if you have mild gum recession, meaning you catch it early and you get treatment right away. Yes, there is a real chance that your gums can slowly grow back. I've seen it happen. The body is amazing at healing when you remove the irritation. However, and this is important if your gums have already receded a lot, I'm talking the root is widely exposed and the bone underneath has already been eaten away, then I need to be straight with you. Completely growing back to the way it looked when you were 20 years old, that is very difficult. The body can only do so much, but do not lose hope. Do not click away from this video because even with moderate or severe recession, if you get treated immediately, you can absolutely stop it from getting worse. You can freeze the disease in its tracks. You can stop the loosening. you can stop the bone loss and you can keep those teeth for the rest of your life. That is the goal. This is why I am always saying early detection changes everything. Don't wait. You might be asking me, doctor, if this is so common, why don't I feel any pain? And that, my friend, is exactly what makes gum disease so dangerous. In the early and even middle stages, there is almost no sharp pain. People notice a little blood on the toothbrush in the morning, maybe some weird taste in their mouth when they wake up, and they tell themselves, oh, I just have too much heat in my body. I'll drink some tea. They ignore it, they put it off, and then by the time you actually feel that tooth wiggling, or you feel pain when you bite into a sandwich, the disease has often been there for years. It's already moderate or even severe. I had a patient, a really nice guy, about 45 years old, worked in sales. He came to see me for a physical, and he mentioned almost as an afterthought, oh, by the way, my gums bleed sometimes. And the other day I bit into a pork chop and one of my teeth just kind of moved. Is that weird? He had been using a soft toothbrush. He thought he was brushing too hard. He even bought one of those expensive fancy toothpastes. Nothing helped. We did an exam. His gum pockets, the space between the tooth and the gum, were already 5 millimeters deep. Healthy as 1 to 3 millimeters. His bone had started to dissolve. He had moderate gum disease. I told him straight, if you had waited another 6 to 9 months, you would be looking at surgery. He was shocked. He had no idea. So please hear me, gum disease is not a small cosmetic problem. It can affect your entire body. And I'm not saying that to scare you. I'm saying it because the science is very clear. The CDC and the American Heart Association have looked at this. People with untreated gum disease have about twice the risk of having a heart attack compared to people with healthy gums. The risk of stroke goes up by about 1.5 times. Some studies even show links to higher risks of lung and stomach problems. And if you have a condition like rheumatoid arthritis or diabetes, gum disease can make your joint pain worse and make your blood sugar much harder to control. Why? Because your mouth is not separate from the rest of your body. Those bacteria living in your infected gums can sneak into your bloodstream. Every single time you chew or brush, they travel to your heart, your brain, your joints, and they cause inflammation everywhere. So treating your gums is not just about saving your teeth, it's about protecting your whole self. Okay, so how can you check yourself for gum disease right now? At home, you don't need any special tools. I'm going to give you 3 simple tests that I teach all my patients. Test number 1, look at your gum color. Stand in front of your bathroom mirror. Pull your lip down. Healthy gums should be a nice, even light pink color, like the inside of a seashell. They should look firm and tight against each tooth. If your gums look dark red, purplish, shiny, or swollen, like they're puffing up around the teeth, that's inflammation. If they bleed when you brush, or even bleed when you just gently poke them with your finger, that's a huge red flag. If you see white or yellow pus coming out from the gum line, that is an active infection, and you need to see a dentist this week. Test number 2, feel your chewing power the next time you eat a normal meal. Let's say a salad with nuts or a piece of chicken. Pay attention. Do your teeth feel weak? Do they ache when you bite down on something slightly firm? Does it feel like your teeth are shifting or moving just a little bit inside the gum? That tells me the disease has already started affecting the stability of your teeth. The foundation is getting shaky. Test number 3, look at the shape of your teeth. Stand in front of the mirror. Again, look at your front teeth. Do they look longer than they used to? Are the spaces between your teeth getting bigger? That's gum recession. Also, look at the alignment. Are your front teeth slowly shifting, getting crooked? That's another sign. Your teeth shouldn't move on their own as an adult. Right now, after this video, go do those 3 tests. And if you see any of these signs, do not panic, but do not ignore them either. Call your dentist or your primary care doctor. Now, let's talk about the different levels of gum disease because not all of it is the same. We look at 2 main things, the depth of the gum pockets and how much bone has been lost. Level 1, mild gum disease. This is technically called gingivitis. In this stage, your gums are red and they bleed. But the pocket depth is usually less than 3 millimeters. The bone is still healthy. This is the easiest stage to treat. In fact, a simple standard dental cleaning, the kind your insurance probably covers twice a year, can fix this after that cleaning, plus better brushing and flossing at home. You will see noticeable improvement in about 3 days to 1 week. The bleeding stops, the redness goes down, the bad breath improves. Level 2, moderate gum disease, periodontitis. Now the pocket depth is between 3 and 6 millimeters. The bone has started to dissolve. You'll see more gum recession. Your teeth might feel slightly loose A regular cleaning won't work anymore because the bacteria and tartar are now deep under the gum line. You need what's called a deep cleaning, scaling, and root planing. The dentist numbs you a little and scrapes the roots of your teeth clean. It's not the most fun afternoon, but it's very doable after that. You'll need to be extra diligent with your home care. Over the next 1 to 2 weeks, things will start to calm down. Level 3, severe gum disease, pocket depth more than 6 millimeters, significant bone loss. Your teeth are noticeably loose. At this point, you are often looking at surgery like flap surgery, where they literally pull the gum back, clean everything out, and stitch it back. And if too much bone is gone, they might need to do a bone graft, using artificial bone or bone from another part of your mouth to rebuild the foundation. This is a big deal. Recovery takes 1 to 2 months and it's expensive even with insurance. This is why we never want to get here. Now, a lot of people ask me about laser treatment for gum disease. Is it worth it? Lasers can be a helpful addition to treatment, especially for moderate disease. The laser can zap bacteria in those deep pockets more precisely than a metal scraper. It can also stimulate some healing and tissue regrowth. Recovery is often faster with less pain, but here's the important thing you need to know. Laser treatment is usually not covered by insurance. It's an out-of-pocket expense. The price varies a lot from office to office, so if your dentist recommends it, ask for a written estimate. You can also check the fee schedule on your state university dental school's website. But remember this, whether you get laser or scaling, you still have to do the daily cleaning at home. No laser in the world will save you if you don't floss. Before we go any further, I need to bust some myths because I see this nonsense all over social media and it is hurting people. Myth number 1, if I just quit sugar, my gum disease will go away. No, that is not true. Sugar makes bacteria grow faster. Yes, but the root cause of gum disease is not sugar. It's plaque, that sticky film of bacteria and tartar, that hard cement-like stuff that only a dentist can remove. You could eat 0 sugar for a year, and if you still have tartar on your teeth, your gum disease will not get better. Cutting sugar is great for your overall health, but it is not a treatment for gum disease. Myth number 2, a water flosser is just as good as regular floss or interdental brushes. Not exactly. A water flosser is wonderful for blasting out big chunks of food from between your teeth. It feels nice. But for actually scraping off the sticky, clingy layer of plaque that is glued to the surface of your tooth, string floss or a small interdental brush is much more effective. Think of it like washing a dirty plate. A water flosser is like a strong sprayer, it gets big stuff off. But your finger with a sponge, that's the floss, gets the sticky residue. Use both if you can. Myth number 3, I can just rinse with salt water or mouthwash instead of brushing. Absolutely not. Please do not do this. Salt water and mouthwash can temporarily kill a few surface bacteria and make your breath smell better for 20 minutes, but they cannot remove plaque or tartar. They cannot scrub the surface of your teeth. And if you use a strong mouthwash every single day for months, you can actually dry out and irritate your gums. Making recession worse, you have to brush twice a day, no shortcuts. And while we're at it, let's fix a few common mistakes that I see all the time. Mistake 1, brushing too hard. So many of my patients think that if a little pressure is good, a lot of pressure is better. That is wrong. Brushing hard does not clean better. It damages your gums and wears away your enamel. Use a soft bristled brush. Brush gently for 2 full minutes twice a day. Mistake 2, using a toothpick or a piece of metal or a fishbone to pick your teeth. Please stop. Toothpicks are sharp. They poke your gums. They cause tiny injuries that get infected, and over time, they actually make the gaps between your teeth wider. Fish bones are covered in bacteria. Just use floss or an interdental brush. It's safer and cleaner. All right, now let's get to the part that everyone really wants. How do you prevent this from ever happening or stop it from getting worse? How do you become one of those 99-year-olds who still has all their own teeth? There is no magic pill. I wish there were, but there is a simple, proven system and it works. Number 1, master your daily home care. This is the foundation. I recommend the base brushing technique to all my patients. Hold your soft brush at a 45-degree angle, pointing right at the line where your tooth meets your gum. Then make tiny, gentle side-to-side vibrations, like you're polishing a tomato. Do that for about 3 to 5 seconds on each spot. Brush every surface, the outside, the inside, and the chewing surfaces. And don't forget your tongue. Brush your tongue gently every time. Do this for 2 full minutes. Set a timer if you have to. Replace your brush every 3 months, but brushing alone is not enough. Most gum disease starts between the teeth where your brush cannot reach, so you must clean between your teeth. Use string floss once a day, ideally at night before you brush. Take about 20 inches of floss. Wrap it around your middle fingers, slide it gently between your teeth, and then curve it into a C shape against the side of each tooth. Scrape up and down. You should feel it cleaning. If your gaps are larger, use interdental brushes, those tiny little Christmas tree-shaped brushes. Ask your dentist which size fits you. Do not guess. For people with big gaps, these are much more effective than floss. Number 2, get regular professional cleanings and checkups. Even if you are perfect at home, you will get some tartar buildup over time. You cannot brush it off. It has to be scraped off by a professional, so I tell my patients every 6 to 12 months, get a cleaning, and once a year, get a full comprehensive oral exam. That's how you catch things early. And if you have a family history of gum disease, listen carefully. About 30% of people have a genetic tendency. They can do everything right. Brush, floss, eat well, and still get gum disease. That is not fair, but it is reality. If that is you, you need to be even more vigilant. Don't skip your checkups. Number 3, change a few key lifestyle habits. If you smoke or use any kind of tobacco, please try to stop. I know it's hard. I'm not judging you, but tobacco is terrible for your gums. It shrinks the blood vessels, so your gums don't get good blood flow. They can't heal. And ironically, tobacco can hide the signs of gum disease. You won't bleed as much, even though the disease is getting worse. Many smokers don't realize they have a problem until their teeth are already loose. Talk to your doctor about quitting. There are medications and resources that can help. Watch what you eat, not for weight, but for gum comfort. If your gums are already red and sore, very spicy foods, scalding hot coffee, or ice cold drinks can really irritate them. Try to eat more fresh vegetables and fruits, especially things with vitamin C, like oranges, bell peppers, and strawberries. Vitamin C is essential for gum repair and collagen production. Stop using your teeth as tools. Do not open bottles with your teeth. Do not chew ice cubes. Do not crack nutshells with your molars. That destroys enamel and can fracture teeth and damage gums. Now, 2 groups of people need to pay extra attention here. First, people who are in braces or clear aligners. Orthodontic appliances make it much harder to clean your teeth. Food gets trapped around every bracket and wire. You are at higher risk for gum disease during treatment. You will need special orthodontic brushes, water flossers, and probably more frequent professional cleanings. Please be diligent. Second, pregnant women. Pregnancy hormones change how your gums react to plaque. You might develop what's called pregnancy gingivitis, very red, swollen, bleeding gums. This is common, but don't ignore it. Untreated gum disease during pregnancy has been linked to premature birth and low birth weight. So take extra good care of your mouth while you're pregnant. Keep brushing, keep flossing, and see your dentist for a cleaning. It is safe during pregnancy. So let me leave you with this final thought. I often get asked, Doctor, what's the secret of those 99-year-olds who still have a perfect set of teeth? There is no secret. They just did the boring stuff every single day for decades. I had a patient, a wonderful gentleman who was 96 years old. He came in for a physical. His teeth were perfect, not a single loose tooth. He told me his routine: soft brush, gentle base technique, floss every night, interdental brush in the morning, a cleaning every 6 months like clockwork, never used a toothpick, never smoked. He could still eat roasted nuts and grilled pork chops without any trouble. He didn't have expensive lasers or fancy toothpaste. He just had consistency. You can do this too. It doesn't matter if you're 22 or 68. You can start today and you can keep your teeth for life. Let me summarize everything for you so you remember. Can receding gums grow back? Mild recession caught early. Yes, often yes. Moderate or severe recession. Complete recovery is difficult, but you can absolutely stop the disease and prevent further loss. Gum disease is not a death sentence for your teeth. You can turn around mild gingivitis and bad breath in as little as 3 days. 3 days, that should give you hope. Having a full set of healthy teeth at 99 is not a fairy tale. It is a choice you make every single day with your toothbrush and floss. Here are your action steps for today. 1, go to your bathroom mirror. Do the 3 self-checks I showed you. Look at your gum color. Feel your chewing power. Look for recession and shifting. 2, if you see anything concerning, call your dentist or your primary care doctor this week. Do not wait. 3, tonight brush for 2 full minutes using the gentle base technique, then floss before bed. 4, if it's been more than 6 months since your last dental cleaning, pick up the phone tomorrow and schedule one. And if you found this helpful, please do me a favor. Share this video with one person you care about, especially if you've noticed they cover their mouth when they laugh or they complain about bleeding gums. You might help them save their teeth. Disclaimer: this video is for educational purposes only. I am not your personal doctor. Always consult your own primary care provider or dentist before making any changes to your health routine. If you are dealing with any health concerns, please schedule a visit with your own doctor. I am here to help you understand the science, not to replace professional medical advice. Now, drop me a comment below. Have you ever noticed bleeding when you brush, or are you someone who has struggled with flossing? Let me know. I read as many comments as I can, and I will try to answer your questions. Don't forget to subscribe to the channel, hit that bell so you don't miss the next video. We talk about real practical health topics that actually matter to your everyday life. Take care of yourselves. Be well, and I will see you in the next one.